Your doctor is missing 5 critical tests that could save your life and your sex life. And it's not incompetence, it's lack of time, outdated protocols, and insurance companies that won't pay. These 5 tests uncover problems before symptoms show up. Aggressive prostate cancer, destructive low testosterone, silent cardiovascular disease, hidden diabetes, and chronic inflammation. I'm going to reveal exactly which tests to request, the ideal values you should aim for, and how to interpret the results. Stay until the end because I'll give you the complete script to take to your doctor. Let's get started. Hello, I'm Dr. Roberto Andrade, and today I'm going to give you the power to take care of your own health proactively, not reactively. The Brazilian healthcare system, both public and private, works like this. Doctors have 15 minutes per appointment, follow standardized basic protocols, order the minimum tests that insurance covers. The result? Serious problems are detected late when they've already caused irreversible damage. But there's a different approach. Personalized preventive medicine. Specific tests that reveal imbalances years before they become diseases. And the best part? Most of these tests are available through SUS or cost little at private labs. Today, you're going to learn which tests every man over 50 should have annually, but that most doctors don't mention. And you'll learn to interpret the results because many doctors only look at whether it's within reference, range, but ignore whether it's ideal. Before we start, subscribe to the channel, turn on notifications, and leave your like, because this information could literally save your life. Let's go to the 5 forgotten tests. The first test that every man over 50 should have, but that few doctors order, is free testosterone, not just total testosterone. Most doctors order total testosterone, and that's it. But this is insufficient. Why? Because total testosterone measures all the testosterone in your blood, but most of it is bound to proteins, SHBG, sex hormone-binding globulin, and is inactive. What matters is free testosterone, the fraction that's available for your tissues to use. You can have normal total testosterone, but very low free testosterone, and feel all the symptoms: fatigue, loss of libido, difficulty with erections, depression, muscle loss. Reference values are different from ideal values. Total testosterone. Reference 300, 1000 around DL. Total testosterone, ideal for men, 50 plus. 600, 800 Nengi DL. Free testosterone. Reference 521 pg/ml. Free testosterone, ideal, above 15 pg/ml. If your doctor says 350 ngdl is normal because it's within the reference range, he's wrong. You're going to feel terrible at that level. You want to be in the upper third of the reference range, not at the minimum. And important, also request SHBG, sex hormone-binding globulin. If SHBG is high, it kidnaps your testosterone, leaving little free and available. High SHBG can be caused by XSA, alcohol, overburdened liver, boron and magnesium deficiency. When to do it? Annually after 40, or immediately if you have chronic fatigue, low libido, difficulty with erections, depression, abdominal fat gain. Where to do it? Any laboratory. Private cost? Rady, 150. 12-hour fast. Collection in the morning. Testosterone is highest in the morning. The second crucial test is fractionated PSA, free PSA and total PSA, not just total PSA that most doctors order. PSA, prostate-specific antigen, is the marker used to detect prostate problems, including cancer. But total PSA alone is imprecise. It rises both in cancer and in benign enlarged prostate, BPH. The secret is in the ratio between free PSA and total PSA. This ratio indicates whether high PSA is more likely to be cancer or just benign growth. Interpretation: total PSA below 4 ng/ml, generally normal. Total PSA 410 ng/ml, gray zone, needs free PSA. total PSA above 10 ng/ml. Concerning, investigate free total PSA ratio. Above 25%. Probably benign, BPH, 15 to 25% intermediate zone monitor. Below, 15% high cancer risk, biopsy needed real example. Man with total PSA of 8 ng/ml seems concerning, but if free PSA is 2.4 ng/ml, the ratio is 30%, 2.4, $8.030. This indicates benign growth, not cancer. No panic, just monitoring. Another man with total PSA of 5 ng/ml seems okay. But if free PSA is 0.5 ng/ml, the ratio is 10%, 0.5, 5, or 0.10. High cancer risk needs urgent investigation. Doctors who order only total PSA miss aggressive cancers or cause panic and unnecessary biopsies. Fractionated PSA is essential for the right decision. When to do it? Annually after 50 or after 45 if you have family history of prostate cancer. Where to do it? Any laboratory. Private cost, $5,100, no fasting needed, and go ahead and leave your like. The third forgotten but vital test is hemoglobin A1C, HbA1c, not just fasting glucose that your doctor orders. Fasting glucose measures your blood sugar at that moment, but you can have normal fasting glucose and still have prediabetes or hidden diabetes. Why? Because glucose varies throughout the day. You can have very high spikes after meals, but if you fasted 12 hours before the test, fasting glucose will be okay. Hemoglobin A1c, HbA1c, measures the average of your sugar over the last 3 months. It's the test that reveals the truth about your glycemic control. Values and interpretation. HbA1c below 5.7%, ideal, healthy metabolism. HbA1c 5.7, 6.4%, pre-diabetes, danger. Zone reversible. HbA1c 6.5% or higher. Diabetes, needs urgent treatment. Why does this matter for male sexual health? Because diabetes and prediabetes destroy testosterone and cause erectile dysfunction, chronic high sugar damages, penile nerves, diabetic neuropathy, loss of sensation, penile blood vessels, difficulty with erections, Leydig cells, reduced testosterone production. Studies show that men with diabetes have 3 times higher risk of erectile dysfunction and testosterone, 30%, lower than men without diabetes. And the worst part, prediabetes is silent. You can be destroying your body for years without knowing because fasting glucose is still normal. Hemoglobin A1c reveals this before it becomes irreversible diabetes, and prediabetes is reversible with lifestyle changes, low-carb diet, intermittent fasting, strength exercises. When to do it? Annually after 40, or immediately if you have, abdominal weight gain, fatigue after meals, excessive thirst, frequent urination. Where to do it? Any laboratory. Private cost, $30, $60, no fasting needed. The fourth crucial test is advanced lipid panel. Not just the basic total cholesterol and HDL, LDL that everyone does. Basic lipid panel measures. Total cholesterol, HDL, good cholesterol, LDL, bad cholesterol, triglycerides, but this is insufficient. Why? Because not all LDL is equal. There are large LDL particles, pattern A, that are harmless, and small, dense LDL particles, pattern B, that are highly atherogenic. They cause arterial plaques. You can have high total LDL, but if they're large particles, no problem. Or you can have okay total LDL, but if they're small, dense particles, you have high cardiovascular risk. Advanced tests include apolipoprotein, B, ApoB, measures the number of LDL particles. The higher, the worse. Ideal, below 80 mAs, DL. LDL particle size, reveals whether they're large, safe, or small, dense, dangerous. Lipoprotein, A, LPA. Genetic risk factor, if high, above 30 mAs/dL, you have increased risk independent of LDL. Why does this matter for sexual health? Because atherosclerosis, arterial plaques, doesn't just affect the heart, It affects the penis first. Penile arteries are the smallest in the body, 1 to 2 millimeter diameter. Coronary arteries are 3 to 4 millimeters. Plaques clog the penis before they clog the heart. Erectile dysfunction is the canary in the coal mine, the first sign of cardiovascular disease. If you have difficulty with erections, your heart may be in danger too. Advanced lipid panel reveals this risk years earlier, allowing early intervention. When to do it? Once after 40 to establish baseline, then every 2 to 3 years or annually if you have family history of heart attack, stroke. Where to do it? Larger laboratories, Fleury, Delboni, Sabin. Private cost, $200, $400, 12-hour fast. The fifth and final forgotten test is high-sensitivity C-reactive protein, hsCRP, the chronic inflammation marker that nobody orders but should. Low-grade chronic inflammation is the root of practically all modern diseases: heart disease, diabetes, cancer, Alzheimer's, obesity, erectile dysfunction, low testosterone. It's like a silent fire burning your body 24 hours a day, progressively destroying tissues. And you don't feel pain, don't have clear symptoms, but the damage is happening. C-reactive protein, CRP, is produced by the liver in response to inflammation. hsCRP, high sensitivity, measures very low levels of inflammation that common CRP doesn't detect. Values and interpretation. hsCRP below 1.0 mg, ideal, low risk. hsCRP 1.0, 3.001 mg, moderate risk, attention. hsCRP above 3.0 mg, high risk, severe chronic inflammation. Studies show that men with hsCRP above 3.0 mg have double the risk of heart attack, triple the risk of erectile dysfunction, testosterone 20–30% lower, quadruple the risk of type 2 diabetes, causes of chronic inflammation, obesity, especially visceral fat, diet high in refined carbohydrates and vegetable oils, sedentary lifestyle, chronic poor sleep, chronic stress, chronic infections, gums, intestines, environmental toxins. The great news? Chronic inflammation is reversible. With lifestyle changes, you can reduce hsCRP from 5 to 6 mg/L to below 1.0 mg/L in 3 to 6 months. Interventions that work: anti-inflammatory diet, low-carb, high omega-3 antioxidants, regular exercise, strength plus aerobic, quality sleep, 7 to 8 hours, stress management, meditation, breathing, supplements, omega-3, 2,3G day, curcumin, vitamin D3, when to do it, annually after 40 or immediately if you have, chronic fatigue, joint pain, unexplained weight gain, cardiovascular problems, or erectile dysfunction. Where to do it? Any laboratory. Private cost, $30, $60, no fasting needed. Now you know the 5 forgotten tests, but how to act. Step 1, print or write down this list. 1, free testosterone, plus SHBG. 2, fractionated PSA, free in total. 3, hemoglobin A1C, HbA1c. 4, advanced lipid panel, ApoB, LPA. 5, high sensitivity, C-reactive protein, hsCRP. Step 2, schedule an appointment with your doctor and request these tests. If he says it's not necessary, insist. You have the right to request. If he refuses, find another more up-to-date doctor. Step 3, get the tests done. Total private cost if your insurance doesn't cover $400, $700. It's less than a cell phone and can save your life. Step 4, when you receive the results, don't accept just "it's normal." Ask for the exact values and compare with the ideal values I gave in this video. Step 5, if any value is outside the ideal, act. Lifestyle changes solve 80% of problems. Medications are the last option, not the first. Important: this video is educational. It doesn't replace medical consultation. Use this information to be an active partner in your health, not to self-diagnose. Are you going to request these 5 tests? Look, I've already seen hundreds of men discover serious problems years before symptoms appeared thanks to these tests. And because they discovered early, they reversed everything with simple lifestyle changes. Prediabetes reversed, chronic inflammation controlled, testosterone optimized, cardiovascular risk reduced. And the consequence? More energy, strong libido, better erections, more defined body, longer and healthier life. In the next video, I'm going to reveal the complete supplementation protocol for men 50 plus, which supplements actually work, correct doses, when to take them, and which are garbage. Don't miss it. If this video was useful, leave your like, subscribe to the channel, turn on notifications, and share with that friend who needs this information. You might be saving his life. And tell me in the comments, do you already do any of these 5 tests? Or are you going to request them now? Comment "will request" and the number of the tests that interested you most. Let's create a community of men who take care of their own health actively. A hug, and see you in the next video.